How can you tell if your eye angles are narrow? Imagine your eye as a tiny water tank with a drain at the top. The angle between the iris and the cornea is like that drain opening. If it's too narrow, fluid can't drain properly, which might lead to problems like glaucoma. But how can you really tell if your angles are narrow? The truth is, most people don't notice any signs until something serious happens. That's why regular eye exams are so important, especially if you have risk factors. Narrow eye angles usually don't cause symptoms early on. You might feel perfectly fine with no pain or vision issues. But certain factors can make you more likely to have narrow angles. For example, if you have smaller eyes, a shallower front chamber of the eye, or if you are farsighted, your angles could be narrower. Age and gender also play a role. Older adults and women tend to have a higher chance of narrow angles. People of Asian, Indian, or Inuit descent are also at increased risk. If the angles are very narrow and fluid cannot drain well, pressure inside the eye can rise suddenly. This is called angle closure glaucoma, and it can cause severe symptoms. You might experience intense eye pain, a headache that feels worse in dim light, blurred vision, or even see halos around lights. Your eye may turn red, and you could feel nauseous or vomit. The pupil might stay dilated and not respond normally to light. These signs are urgent and need immediate medical attention to prevent permanent vision loss. To find out if your angles are narrow, eye care professionals use special tests. The most accurate is gonioscopy, where they place a tiny contact lens with mirrors on your to directly view the drainage angle. They might also use advanced imaging techniques like anterior segment optical coherence tomography, which creates detailed pictures of the eye's front part without touching it. During a slit lamp exam, the doctor can look at the front chamber but cannot see the angle clearly without gonioscopy. If your doctor finds that your angles are narrow but your eye pressure is normal and your optic nerve looks healthy, they will likely recommend regular checkups. Sometimes, they can perform laser iridotomy, which makes a small hole in the iris to improve fluid flow and open the angle. If you have cataracts, surgery might also help by deepening the front chamber and reducing the risk of angle closure. Remember, you cannot tell if your eye angles are narrow just by how your eyes feel or look. Most people with narrow angles do not notice symptoms until a sudden attack occurs. If you have risk factors or experience symptoms like pain, headache, blurred vision, or halos around lights, see an eye care professional promptly. Early detection and treatment are key to preventing serious complications like angle closure glaucoma. Always consult with a healthcare provider for personalized advice and regular exams to keep your vision safe.